Let's shift gears now to Health and Human Services Secretary Robert F. Kennedy Jr.'s highly anticipated Make America Healthy Again. His new report is out, and it's calling attention to a number of issues that Kennedy says is causing disease in America's children. Joining us now, NBC News medical contributor Dr. Vin Gupta. Dr. Gupta, good to see you this morning. So, obviously, the goal of eliminating disease in America's children, a noble one, but there's some real contradictory stuff in the report that Kennedy put out yesterday. Walk us through it, please.
Yeah, Jonathan, good morning. This commission report is heavy on describing problems that you and I, others know exist, very light on real, concrete, novel solutions. There's really nothing here. And so I just want for your audience to recognize that MAHA, as far as we can tell, is a rebranding effort. There's nothing new here behind the scenes, but let's go through it. To your point, there's this focus on environmental toxins, really speaks to RFK's background as an environmental attorney, focus on environmental health, but there's really nothing that, the teeth of that, what are we actually going to do to combat environmental toxins in the environment around us? Hard to do that when you're defunding the EPA and focusing on deregulation. So that's one example. Second example here is this focus on, he says he wants to do more studies on the root causes of chronic disease, especially in kids, for obesity, diabetes, and other conditions. Again, hard to do that when scientific estimates show that NIH funding is going to decrease by $21 billion, Jonathan, by 2027. A lot of these studies also already are ongoing. So what happens to the studies that are ongoing to address these root causes, to better understand them? Not clear. And then lastly, this focus on health prevention. He wants to focus on health prevention. Great goal. We all want to do that to protect our hospitals, keep people at home. How are you going to do that when the most vulnerable are expected to lose, about 10 million are expected to lose Medicaid coverage, which, by the way, also entitlement programs like SNAP and WIC to enable healthier eating comes with that type of coverage. How is this all going to make sense? So there's the rebrand, there's the fancy policy statement and the marketing message, and then there's what they're actually doing here, which is the exact opposite.
Yeah, Dr. Gupta, I wonder how researchers in public health outside the White House and its orbit are actually thinking about the state of children's health in the United States. We're talking about significant mental health challenges, especially coming out of the pandemic, an epidemic of loneliness. A lot of these issues are laid out in this report, and yet, as you said, there's not many recommendations. But where is the energy and where should it be moving forward in public health?
Yeah, well, I mean, exactly right. There are areas here like youth mental health, ADHD that need to get attention. Exactly to your point, actually, what we've learned with, take ADHD is that diagnoses are exponentially increasing, in part because we have better diagnostic tools, but also, what do we do about it? How do we treat folks? Are we being comprehensive in our approach? This is an important topic. It's not getting a lot of attention here or meaningful policy solutions, but also to your point, what's missed? Is this a comprehensive treatment on what's ailing America's children? Number one, it's just factually incorrect. It doesn't account for the fact that guns are the leading cause of death of children, number one. It doesn't mention any of that because it's inconvenient. Number two, when it comes to what's a big risk factor for ill health, youth vaping leads to tobacco smoking. Those rates are still, 10 to 12%. Tobacco is still an issue that is the second leading risk factor for death and disability worldwide. Starts in early childhood or in adolescence. These are not even talked about whatsoever. And also, really important to keep in mind, this is not the sickest generation of American children, as RFK pointed out repeatedly in the afternoon press conference. Life expectancy was 47 years of age in 1900. It is now 78 years of age, attributable largely to better public health, better vaccines, overall better approach to medicine, better innovations.
Dr. Gupta, it's Ali Vitale here in D.C. The thing I hear most frequently from public health professionals is the concern that RFK Jr. as a private citizen was good at muddying the waters, just asking questions, but now he has the imprimatur of being the Secretary of Health and Human Services in this country. Do you see the patients coming in asking you new questions about some of these conspiracy theories? Are the waters really being muddied at the level that you see it on a person-to-person basis?
Absolutely, Ali. Absolutely. Let's take two examples here. One, fluoride as an example. He is taking a random data point that has not been scientifically proven that somehow fluoride at the levels in which we have in our drinking water are somehow toxic to our neurodevelopment, especially amongst children. Not true. It's been proven time again that it is not true at the levels in which it exists in our drinking supply. And yet he's taken this fact, misinterpreted it, and cited it as gospel. Yes, absolutely. We're seeing people ask these questions. Number two, I just had a conversation with the chief medical officer of Texas Children's Hospital, and what she told me yesterday is that people, she doesn't have the time in the day, the 10 to 15 minutes that's required to push back, to provide context on maybe a claim that he's making on the measles vaccine or something that he's not saying that he should, which is full-throated endorsement of it. And it takes 15 minutes to sit there, have a conversation, and really try to reorient. And we just don't have that time to do that.
NBC News medical contributor Dr. Vin Gupta. Thank you, Dr. Gupta, for that important conversation this morning.